All right. Do we have any other questions? If you have a question, please use the question bar on the GoToWebinar screen that is appearing on the side of your screens there, and please enter your question into the question section.
While we're waiting for questions, and I know that you do have some questions out there, so what I want to say is we know that soy is not a carcinogen. And we also know that there's no proof of any causality between soy and breast cancer. In other words, it is not a carcinogen, so it doesn't cause a mutation to occur and for tumors to develop. The American Cancer Society says that up to 3 servings a day of soy foods is considered safe for women both at risk for or with a history of breast cancer. So I think that in my practice, I do see a lot of women who are concerned about this, not only for themselves but for their teenage daughters. They want to know whether or not they should follow the new guidelines and incorporate more animal protein into their diets. And so what we say is that the childhood and adolescent exposure seems to have a beneficial and protective effect, and that women, as long as they've had some soy, if they've been diagnosed with breast cancer, it's most likely very safe for them to continue.
Okay, we have another question. The question is from Terry, and her question is it safe to consume soy products while taking tamoxifen?
I can handle that, Dr. Clarke. Do you want me to look at that? Talk about that, or would you prefer?
We can both go. You can start. If I have anything to add, then I will add.
So this is a great question. Dr. Clarke actually put up some of the evidence from this researcher, and it's Guha et al. And this was an e-publication in 2009, followed 1,954 women with breast cancer, and what they found was for postmenopausal women on tamoxifen who had higher intakes of soy, their recurrence was reduced by 60% compared to women with lower intakes. Because we know that tamoxifen is a SERM, and we also think, well, could soy be a SERM with both estrogenic and anti-estrogenic effects? And what they found was that there was no increased risk for those women, and that there may be some benefit. And these were women who were followed for over 6 years.
Okay, our next question is from Carly.
Dr. Clarke?
Oh, sorry. Go ahead. I'm sorry, Dr. Clarke.
I'm sorry, Dr. Clarke, you didn't have anything to add then?
No. In that Guha study, the finding wasn't significant, but it was into the direction of of a protective effect with combination of tamoxifen and soy.
Okay, our next question is from Carly. Carly asks, how do you feel about consumption of soy protein isolate found in protein powders, bars, or veggie burgers?
My personal opinion is that the Asian soya products are better to consume than products that contain soya protein isolate. So products that contain whole soya beans are better than products that contain soya protein isolate or concentrate.
And this is Barb. So I have to tell you that I agree, but I think this is sort of a class effect. When I talk to patients about any supplement, I think we all learned a big valuable lesson with beta-carotene, that it wasn't necessarily a good idea to give people supplements, and it was better for them to have the whole food. So I think that when we look at soy, the whole soy food seems to have more beneficial effects than trying to isolate some of the isoflavones in soy. And so there's a lot of different whole soy products available. There's tofu, there's tempeh, there's roasted soy nuts, there's soy joy bars, there's soy milk, etc. These are all good examples of whole soy foods that our patients can enjoy.
Okay, our next question is from Melissa. Do you have any advice on how we can begin to educate oncologists that are telling their breast cancer patients that they absolutely should not have any soy?
This is Barb, and Dr. Clarke, please chime in. I was just at the North American Menopause Society meeting, and this is an issue that comes up all the time. There's a huge debate going on among gynecologists and oncologists in terms of any kind of estrogenic exposure, whether it's soy or estrogen, with breast cancer survivors. I think one of the issues is for oncologists is to always bring up quality of life for patients, and then you have to show them the data. I think there's a lot of convincing data for breast cancer survivors on tamoxifen that it will do no harm, that there's no significant decrease in, or there's no significant increased mortality or risk for the patient. I don't think there's any evidence for women on aromatase inhibitors, so I don't think you can make that argument. But I think that there is good evidence that it's a safe option for women who are on tamoxifen or survivors of breast cancer.
Perhaps a good way is to try to separate the soya foods from the products that contain the isolates. So if the clinicians become aware that the soya foods are different than food products that contain purified isoflavones, I think that would be helpful. That the clinicians, in my opinion, should continue discourage people, breast cancer patients, from taking any supplements, but that there's no evidence that consuming soya foods at the level a patient has consumed before the diagnosis is harmful, so that they would safely be able to continue.
All right, this will be our last question because we're almost out of time here. This question is from Stacy. Are there any studies that you know of that have looked at American populations that use more soy products? For example, do Seventh-day Adventists or vegans have a lower incidence of breast cancer?
I haven't now looked recently, but my recollection is that vegetarians have a lower breast cancer incidence than non-vegetarians.
Well, there is a couple of retrospective studies, and there's one by Wu et al. It was published in 2009 in the American Journal of Clinical Nutrition. And what they found was, if you look at Asian American women they were looking specifically in Los Angeles. So they were looking at Asian American women in LA, and what they found was these are women who had high soy intakes as children and as adolescents. They seem to have a protective effect against breast cancer. So they're in America, so they're having American soy products, but because they're in an Asian neighborhood, they were matched. These were matched to Asian women the same ages and ethnicities in the same neighborhoods, and what they found was the women with the higher soy intakes had a lower risk of breast cancer. Does that answer your question?
But I think that in that study the women were still consuming the Asian food products. They were in the West, but they were still consuming tofu and soya milk rather than the Western soya products.
Right, but I think a lot of the soy products that they were consuming were generated in the U.S.
Yes. But I call the Western soya products not necessarily whether they have been done in West or not, but a tofu that has been made here is still an Asian soya product.
Right. Okay. I'm not sure if that answered your question, but there is some data that does show that that women here, if you do a match control in the same neighborhood, same ethnicity, the women who had higher soy intakes as children had a decreased risk of breast cancer as an adult. So is that the last question? Are there any more?
Yeah, I can hear your voice, but nobody else's.
Okay, well, this is Allegra Burton again, and we're going to need to wrap up, but I just wanted to thank our speakers, Dr. Clarke and Nurse Barb, so much for a really excellent presentation and discussion, and thank you very much for all of our attendees. We're really happy that you could be here, and hope this was informative. Thank you.
Thank you.
Thank you.